So hi everyone, my name is Carrie Burgess and I'm with the Saskatchewan Tourism Education Council Department of Tourism Saskatchewan. And we are very pleased to be partnering with Tourism Saskatoon to bring their community commitment initiative to the tourism hospitality sector across the province. This program is the result of consultations with a task force made up of industry, as well as representatives from associations and municipal and health officials. It's designed to provide resources and support for businesses to check or develop their internal controls, mitigating the risk of COVID-19 transmission for their employees, the local community, and visitors. The resources provided do not replace any official guidelines. Instead, they will provide you with additional information to help you operate your business with as much safety and assurance as possible. If you're interested in becoming a community commitment partner through this initiative, with recognition for your business upon completion, we will provide a link at the end of today's webinar. But to start us off, we are very pleased to introduce safety expert, Robyn Reist.
All right, hi everybody. Thank you for tuning in. I'm just gonna try, I am gonna go back, just try to minimize my face on the screen. My name is Robyn and I'm a specialist in occupational health and safety at a small consulting firm in Saskatoon called RCH Consulting. I previously, before this, I finished my master's recently in community and population health at the University of Saskatchewan. And before that, I worked mainly for Cameco and also briefly for the Saskatchewan Cancer Agency. My specialty is what is sometimes called industrial hygiene or occupational hygiene, which is basically looking into invisible hazards. So the types of hazards, not necessarily like a wet floor or a hole you could fall into, but things that you can't see but will potentially make you sick or develop a chronic injury or things like that. Another interest of mine is something called total worker health, which is all about kind of designing safety programs and workplaces so that there's an emphasis on worker well-being and stress reduction. And so you'll hear me kind of talk about stress and things like that in this presentation a bit, and that's kind of where that's coming from. So without further ado, we'll get started. And I put this presentation together initially for Tourism Saskatoon. So if you did see my webinar at Tourism Saskatoon, this is going to be very much the same. So I won't be offended if you leave, but also if you want a refresher, that's great too. So just a quick disclaimer is that the information here is up to date as of today, to the best of my knowledge, but as we all know, the guidance on and the knowledge on COVID-19 and the SARS-CoV-2 virus can change really rapidly. And so if you're watching this as a recording, something in here might not seem to jive with what's the current knowledge of the day, you can even reach out to me. I'll have my contact information to clarify, or just kind of, you can do your own research there too, but just so you know, it's up to date just today and things may even change tomorrow. So the learning outcomes from this are to define what a health and safety risk assessment identify what the transmission risks are for COVID-19, and then learn how to apply that risk assessment process to develop effective controls for the transmission risk of COVID-19 at your business. And then also I will talk quite a bit about understanding the limitations of less effective controls like PPE and procedures and things like that. And what I really want you to get out of that, that section is just to understand that things like masks and procedures should be really more of a complement to other controls and not your main control, because they are very tied to human behavior to be effective. And then we will go through a worksheet that I put together that you can get off of the Saskatoon Community Commitment webpage. It's a risk assessment worksheet that you can use to do a risk assessment for your business. And I'm going to go through a few examples that are on that worksheet just so you can see how it works. So a risk assessment, I think we have a poll to put up for this slide. Yes, all right. So the question for you to answer is, do you have a dedicated person at your organization that is managing your COVID-19 initiatives right now? Just curious to ask about this. So should I be seeing answers, Carrie? All right, so it's almost, about 2/3 don't and 1/3 does. And so, so this presentation would probably be if if that you do have that person at your business, I hope you're the person who's watching this presentation. And if not, this is a good presentation for you and potentially a few other staff members to get familiar with, so that there can be kind of a group of people who are familiar with how this works. So I will talk about a risk assessment now. So this is a common practice in many industries. It's not anything that is proprietary or reinventing of the wheel that I've put together here for Tourism Saskatoon and Tourism Saskatchewan. We've just developed a really modified and simplified process of a risk assessment to specifically address COVID-19, and especially for small businesses within the tourism industry. That's kind of how we've geared our presentation. So you might already have a well-developed risk assessment procedure for your workplace, and if so, that's awesome. This might just kind of complement that or give you a refresher. And this is also not meant to conflict with Reopen Saskatchewan or any other guidelines that you have from maybe a professional organization. It's just a process that will help you actually sort through all of the potentially overwhelming and maybe even sometimes conflicting guidelines that you're hearing, and just understand why certain controls might be being suggested, why they're necessary, and when they might fit into your business. So if you've read through Reopen Saskatchewan, I hope everybody has, there's a part in it that says, have you done a walkthrough where you've identified all the transmission risks in your workplace and dealt with them? This is basically a process for doing that walkthrough that is a little more hopefully comprehensive and easier to understand. And now my slides are not advancing. There we go. Okay. So the risk assessment process is very simple. At its core, it's really just kind of 3 steps. The first is to identify the hazard, and that's a thing that could cause harm. And then the second is identify the risk, which is asking the question, is it possible for the hazard to cause harm if there are no controls in place? And if it is, then you have a risk. And so the third part of that is then you have to figure out how to best minimize the risk as low as possible for that hazard for the specific situation. And so I've got this little guy slipping and falling on a floor, on a wet floor. I mentioned that a little bit earlier, and I'm going to use that as an example going through a little bit. So this is something I'm going to be talking about a lot in this webinar, is the hierarchy of controls. And I think we have another poll question because I'm curious to know if you have seen this before or used it before, or if it's totally new. So I guess as you're voting, I'll just mention that this graphic here is from NIOSH in the States. They've done a lot of work on the hierarchy of controls. And so you can go to their website and read like everything you might ever want to know about it. So again, kind of 1/3, 2/3, it's almost the same. So a few people, about 1/3 of people have seen it before, and about 2/3 of you have not. And I hope that I'll be able to blow your mind today by changing the way you think about safety hazards and the hierarchy of controls. So what it's all about is going from the top to the bottom when you're trying to minimize a hazard, and using trying to put in place the most effective control you can first before you start using things that are a little bit harder to follow, like rules and procedures or PPE. So the top of the hierarchy of controls is elimination, which means completely getting rid of the hazard totally. So if you totally get rid of it, you don't have a risk anymore. So you have minimized your risk all the way to 0. If you can't totally get rid of it, then you try something called substitution, which would be replacing the hazard with something less hazardous if possible. If you can't do that, then you might try to design out the hazard using or called engineering controls. Another way is just isolating people from that hazard so they can't go near it. And then as we get near the bottom, administrative controls and PPE, as I mentioned, are a little less effective because they're very much based in human behavior and humans following the rules. So it's all about maybe training people how to deal with the hazard, or having people wear something that will protect them. Let's see, oh yeah, my slides don't always advance right after that. Oops, okay. So going back to that question, how can we best minimize the risk? So unless you're fully eliminating the hazard and completely getting rid of it, you can't be sure that you're actually preventing the risk completely. So otherwise, there's almost always going to be some risk. But the good news is that the more higher level controls that you put in place, like substitution and engineering, the more effective your risk reduction is going to be. But again, it's likely never to be 0. So in that sense, I would really, really caution people from using the term guarantee your safety. So if you say something to your customers or staff that we've put a lot of controls in place and we guarantee you will not get COVID here, that is really something you shouldn't be saying, because you can't guarantee that unless you're basically staying closed. So that word effectiveness I was talking about on the first hierarchy of controls slide, it basically just means it's the degree of foolproofing or idiot proofing or mistake proofing, whatever word makes most sense to you, you can use so it sticks in your head. But basically the ones at the top, as I mentioned, they're pretty mistake proof, they're pretty foolproof because they don't necessarily rely on human behavior. They don't rely on people following rules to actually work. Whereas once you get towards the bottom, administrative controls like procedures and training and use of PPE, those have a lot more rules to follow, and they do rely on people following them properly in order to be especially effective. So that's why we want to focus on trying to put controls in place near the top where possible. The other bonus with the more effective controls, the mistake-proof controls, are that they're also more inclusive. So they don't rely on people having a certain degree of cognitive and physical ability to actually be able to follow them and be protected. Whereas the ones related to personal protective equipment and administrative controls, they might. And they're also kind of on that line, they're easier for people with kids and children to be able to follow as well, because I know they say that 3-year-olds should be able to wear masks, but I mean, show me a 3-year-old that's going to wear a mask properly. So it's just better to be able to put the more effective controls in place when you can, and then have your, if you still want to use administrative controls and personal protective equipment, there would more kind of be an extra layer of protection on top of those other ones. So I'm just going to go through a quick risk assessment example for an everyday hazard, and that's the wet floor that we were talking about, because this is probably something that everybody has dealt with already, and maybe you will recognize the way you thought about it as we go through this. So the hazard is the wet floor. A risk is without controls. A worker or customer is likely to slip and fall and possibly get injured from that wet floor. So some possible controls now that you're going to put in place, and you ask the question again, what is the best way to minimize the risk? And one thing you have to consider when you're asking this question, which I'll talk about a bit on the next slide, is feasibility of actually putting that in place, such as costs and social factors as well. And so you'll kind of see what I mean as we go through the steps here. So the first, top of the hierarchy of controls, how can you eliminate the wet floor? Don't wash the floor. Is that possible to do? Is that feasible to do? Probably not. Maybe you have a health code that says you have to do it, or you just don't want your business getting disgusting. So you need to be able to clean the floor. Is there a way to substitute a wet floor by using maybe a dry cleaning agent or some sort of cleaning machine that immediately dries the floor after it washes it, so there's never any exposed wet floor? Possibly, but maybe that is like a little too expensive to use, and it's just not feasible for you to put it in place based on your financial situation. So then maybe you would look into engineering controls. So this is, again, kind of isolating people from the hazard or designing the hazard out. So this could be something like completely locking off the area. If it's a certain room, just lock the door until the floor is dry, or just putting up barricades so that people really have to actually work hard to ignore that. Otherwise, they should be able to see it and know that they shouldn't go there. If that isn't feasible, or if it's too big of a situation or something like that, the administrative controls for a wet floor would be things like a caution wet floor sign, where the thing you have to remember with this is that sometimes this may not be totally effective, because I don't know about you, but I think everybody has seen a wet floor sign that gets left up multiple hours or even days after the floor has already dried. And so people can start to get complacent with those signs because they aren't sure if it's actually there for a reason or not. So that's just one example of why that may be less effective. And then PPE, so if you still think you need something to protect people right at the person level, maybe there's such a thing as like boots with special grips that will prevent them from falling on the floor. I don't even know if that exists, but I just kind of made that up. But again, you can probably see how this becomes less feasible in certain ways. The boots, who's going to buy the boots? Are you going to expect your your staff to spend $200 on the special grippy boots, or are you going to buy them for your staff? Who is going to enforce to make sure that they put them on before they walk across the wet floor? How long is it going to take them to put on? Things like that. So that's why things start to get complicated once we get into administrative and PPE type controls. So a bit more on the feasibility. So the cost question is really, can you afford it? And the caveat there is that not being able to afford it doesn't necessarily give you a free pass to just ignore it, but you do have to then come up with an alternative control to put in place. And with social considerations, the question really is how, like, can you reasonably expect your customers and staff to be able to adapt to it and still go about their business as normal or as best they can with the control in place? And if not, again, you would need to come up with an alternative control that works for them. It doesn't mean that people are being jerks if they don't follow the control. There's just a lot of, things to consider. If a control is going to stress people out too much so that they don't want to even come into your business anymore, then that's a problem for you. And, you can't really just expect people to adapt to certain things that might be too hard for them to adapt to. So that's really what I mean by feasibility, and I do have a spot on it on the risk assessment worksheet to think about that when you're putting your controls in place. So now I will get into the COVID part, what everyone's here for. I'm going to talk about the COVID-19 transmission risks. So the hazard, of course, is the SARS-CoV-2 virus, and the risk is that you will be exposed to the virus and get the disease COVID-19. And so there's two kind of main ways that this disease can seem to be transmitted. The first is person to person, and this is what you should consider your priority because this appears to be the easiest and the easiest way that it's transmitted. So it's either transmitted kind of, maybe I like to think about it in two ways. Transmission via large respiratory droplets from an infected person getting into your respiratory system. So somebody coughing or sneezing and you being right there and inhaling that right away. Or smaller potentially respiratory droplets, which would be from prolonged contact. So like having a close conversation with somebody in a poorly ventilated space especially. And prolonged contact, according to Health Canada, is defined as more than 15 minutes. That doesn't mean like if you're talking to someone for 14 minutes, you're all good. It just means that that's what they're, I think that's what they're using for contact tracing. You can read more about that on, I have a resource that I'll post at the end about that. And the second type of transmission risk is the surface and contact. So this would be transmission via touching something with an infected person's respiratory droplets on it and then touching your own mucous membranes. And so it's important to remember for this one that it's not like if you're infected, your COVID is oozing out of your skin pores, and if you touch something with perfectly clean hands, it's going to have COVID all over it. It still has to come from your respiratory system, get onto that object, and then someone else has to touch that object and then get it into their own respiratory system. So it's a bit more of a complex transmission versus just breathing from one person's droplets breathing out and breathing into another person, which is why we say that person to person should be the priority that you're trying to think about. That doesn't mean you can stop cleaning, but that's the one that you should be thinking about the most. So to simplify this, because that was maybe a little bit of too much information on that slide, I'm not sure, but the way to really break it down is to think about it in this way. 3 questions and 2 kind of sub-questions. How can we keep people at least 2 meters apart? This, again, should be kind of your priority. And then if that's not possible, then how can you prevent people from getting respiratory droplets on each other? So you can probably tell that the larger font on this slide is connected to the higher level controls, elimination, substitution, engineering, and the lower level ones are the more lower level, or the smaller font is the lower level controls. And the second question, how can we ensure people don't have to breathe the same air for extended periods of time? And the third question, how can we prevent people from touching things that might have infectious droplets on them? And if that's not possible, then how can you ensure people are able to wash their hands after doing so, or that you can continually clean those areas that might have infectious droplets on them? So now you would perform a risk assessment using those questions. So the way to do that would be to first consider the unique tasks that your business performs and then break down each job duty into a list of steps. And so the list of steps is kind of like, it's not like if your business was like Subway, for example, one step isn't put lettuce on the bun, the next step isn't put cheese on the bun, the next step isn't put meat on the bun. It's all make the sandwich as per the customer's order would be one step. And then you consider the potential for each transmission risk for each step, and then start from the top of the hierarchy of controls. Think about what controls you might be able to implement for each level, and then kind of choose them. So the higher level controls, they might seem a little more expensive, but they often have kind of more like a one-time setup cost, and then you're good to go. If you are finding as you're doing your risk assessment, if your only feasible things you can put in place are administrative controls and PPE, things to consider would be that these often have ongoing per use costs and may be more expensive in the long term. And they also may be less sustainable long term, either financially, environmentally, or just really hard for people to keep following and not get complacent. And the big question, of course, for businesses that have customers is that can you rely on your customers to follow the rules that you might be putting in place in order to keep your employees safe? Because you're not training your customers. You can train your employees and enforce their behavior, but it's much harder to do that with customers. So what I'm going to do next is go through each level of the hierarchy of controls, talk about how to think about it in terms of these COVID risks, and talk about some common solutions that we've seen and see how they fit into the hierarchy of controls. So for elimination, what you want to eliminate, if possible, is the need for people to be less than 2 meters apart, the need for multiple people to touch things, and the need for multiple people to breathe common air for extended periods. So some common solutions we've seen for this are performing tasks remotely, like work from home, having virtual experiences like, I don't know, like a virtual museum tour or things like that. But that's one of those things that, I mean, it's cool that people are doing it, but I think most people actually want to get out there and have those in-person experiences. So that's not necessarily a sustainable thing. And then just staying closed, which of course is also not sustainable. So eliminating things completely do reduce the risk to effectively zero, but it's not really reasonable for the majority of customer-facing tasks in the tourism industry. So as you go through, you might find that there's bits of things that you can eliminate, but it is unlikely that you'll be able to eliminate all risk within your business. So with substitution, the things you want to substitute then would be the need for people to be less than 2 meters apart, the need for multiple people to touch things, the need for multiple people to breathe common air for extended periods of time. So some common solutions we've seen here, and this is, we've seen a lot of really great substitution, I think, in place, especially kind of during the lockdown. People came up with really creative substitution ideas. So curbside pickup and delivery is it's a great example of substitution. You're not having customers have to come into the store or the restaurant, and so you're substituting that interaction. Having customers seat themselves in a restaurant and using like a chalkboard menu or a digital menu instead of handing out individual menus to people. At a hotel, this would maybe look like self-check-in and self-checkout, so they're interacting with a computer instead of another person. Using disposable items and having the customers dispose of them themselves. So this may not fit with people's environmental goals, so that's something to consider potentially as a feasibility. And then conducting some business activities outdoors. So a really, really awesome substitution that can happen is if you can substitute indoor ventilation for outdoor ventilation, that's going to be really huge. So these are some examples of that. So engineering is all about then designing out the ability of people to be less than 2 meters apart, or designing out the ability of people to cough or breathe in each other's faces, designing out the ability of multiple people to touch things, and designing out the ability of multiple people to breathe common air for extended periods of time. And so engineering, like, it just means it can be really, really simple. It doesn't mean you have to be an engineer to do it. That's just the word for kind of designing creative solutions. So some common solutions we've seen of engineering controls are those plexiglass barriers, like any kind of a sneeze guard is an engineering control. Similarly, extending countertops so that people physically cannot get within 6 feet of the cash desk, for example, and having barricades in aisles to promote one-way traffic and things like that. For the touching, the contact, having on-off motion sensors in bathrooms is an awesome engineering control. Having automatic doors or even just propping a door open is an engineering control, because you've now designed out the need for people to actually touch and open that door. And regarding the breathing air in multiple people, so improving indoor ventilation is an engineering control. So there's really simple things you can do, like just open your windows and doors so that there's better airflow inside, keeping your bathroom vent fans running so that if someone goes in the bathroom and like coughs or sneezes, that air is continually venting out. Maybe using HEPA air purification in certain areas where that's really your only option, or even just like, you know, you can do a complete ventilation overhaul if you have the funds to do so, but I don't know that that's necessarily where a lot of people are at right now. And then one thing that I think is kind of cool with especially engineering controls, that you can potentially design some really fun controls and controls that actually make people want to use them. And that's the goal. That's like the biggest win you can have in designing safety controls, is if they actually make people want to actually be safe because they're fun, because it's fun to be safe. So a couple examples are this book delivery alligator. I think they call it the crock drop, actually, at the Regina Public Library. So when you're doing your curbside pickup of books, the librarian or the library assistant, instead of having to hand the books to you and get within 6 feet, they put them at the top of the slide and you grab them out of the alligator or the crocodile's mouth. And then these bumper tables, which I thought were pretty cool. I think this is a bar in like Maryland in the States where they keep you physically cannot get within 6 foot of somebody, but it's kind of fun to, it's a novelty to be able to use this. And so these are just a couple examples of saying, like, engineering is kind of a word that people think is boring, but it doesn't have to be boring. A bit more on improving ventilation, just in case you're curious about what more things that could look like. You could talk to an HVAC technician if you want to, but if you want to just kind of investigate it yourself a bit, the American Industrial Hygiene Association Back to Work Safely guidelines are the ones that the set of guidelines I've seen that talk about ventilation the most out of anything else. Like most guidelines kind of mainly say like improve your ventilation or get some more outdoor ventilation. But this actually talks a bit about like kind of humidity levels and things like that you can strive for if you do want to improve it. So you can go to this website and they have guidelines that are geared to specific types. They have like restaurant guidelines and hotel guidelines and that kind of stuff, just like we have for Reopen Saskatchewan. So now administrative controls, you're seeing, I'm kind of starting to see a bit more words on the slide, and that is also representative of kind of how complicated things start getting once you get to the lower end of the hierarchy. So administrative controls is about making policies or procedures or training for keeping people 2 meters apart or preventing people from coughing or breathing in each other's faces. Policy is about preventing people from touching things that might be infected or making sure they can wash their hands after or get things cleaned after, or ensuring people don't breathe common air for extended periods. And so, I mean, signage is a very common administrative control. I didn't put it on the slide, but that's reminding people is an administrative control. Some other common solutions are the 6 foot indicators on the floor or directional markings. So these, they're really great to have them, but if people don't see them or if they don't pay attention to them or if they just don't feel like using them, they're not going to be as effective as they're supposed to be. Having a hand hygiene policy or cleaning things that have been touched or used. This is, again, an administrative control in my opinion. I've heard people say that this should be elimination because if you wash your hands or sanitize your hands, you're eliminating the virus off of that thing. But it does rely on the human doing the cleaning to actually do it properly. And if they don't clean it properly, then that's only as effective as the person's with the way that they've cleaned it. And so again, it is reliant on human behavior, so I consider it administrative. Limiting capacity or time in a business is one to just kind of remove the huge amount of people breathing common air or crowding or things like that. Having like a no small talk policy, so people just release less respiratory droplets, but that is, again, something people have to remember to do. And having a non-medical mask use policy. So you may be thinking, okay, I thought masks were PPE. So I will talk in the next few slides about why a non-medical mask shouldn't really be considered PPE. Because they are something that protects others from you. They're not personal protective equipment. Is something that should protect you from the hazard at the source of you. And so I think you could potentially even make a case that a non-medical mask use is an engineering control because it's controlling the hazard at the source, but at the same time, it is reliant on human behavior so much that it is more similar to PPE. So it's this weird hybrid, so I'm just putting it in administrative controls. And so what PPE actually is, personal protective equipment, is the definition of PPE. And what it means is that you're wearing equipment that, if used correctly, is officially rated to protect you from breathing in infected respiratory droplets or getting them on your mucous membrane. So the approved solutions for this virus, if they are required by Reopen Saskatchewan or an assessment that you've done that says you do need PPE, would be things like a medical grade surgical or procedural mask, a medical gown, safety glasses, face shields, or if you do have an aerosol transmission risk, which is likely that you don't, but if you do, then you would need respiratory protection. And in that case, you need to follow the OHS regulations for that. And I'll talk about that in an upcoming slide, what that means. So now I'm going to talk a bit more about masks. I'm trying to kind of keep it concise in the next few slides, but I could tell you I could probably talk about masks for 5 hours. So if you want to have a longer conversation, you can give me a call. So non-medical masks, at least according to the Reopen Saskatchewan appropriate use of PPE guidelines, currently they are not considered PPE. And again, the reason for that is that PPE means personal protective equipment, and something that protects others from you is not personal protective equipment. This is kind of like a new thing that we're dealing with in the safety world, because we've never really had this like situation where you're supposed to wear something to protect others from you. And so it doesn't really fit with PPE, even though it kind of seems like it should be. So it's kind of confusing for everybody involved, and you'll see it be confusing mentioned in different guidelines and stuff as well. So if you're confused, everybody's confused. So if you've done your risk assessment or the guidelines state that you should have PPE for certain tasks, currently, at least the way it's written, is it has to be approved as adequate PPE for COVID. This may change if we have more issues with supply chain and things like that. But right now, you're still supposed to use a surgical mask or respirator if you actually need personal protective equipment. So PPE has to be used properly to be effective. This is the major limitation of it. And properly means according to the manufacturer's instructions and any associated safety regulations for that. It includes proper training in how to use it, making sure you put it on and take it off properly, inspecting it when you need to, and disposing it properly when it needs to be disposed. You can look in the OHS regulations section 87 for more guidance on what the rules around PPE are. So I do want to talk about this issue of redonning masks, so putting them back on again. And this is for medical or non-medical masks. So kind of technically, if you have been wearing a mask and it's potentially gotten someone else's respiratory droplets on the outside, you should consider that potentially contaminated and should not be putting that mask back on again, because there's a chance you could contaminate the inside of the mask when you take it off and put it on, and then you're going to breathe in those droplets. So, I mean, if you haven't come into contact with a single person while you're wearing that mask, it's fine. But otherwise, if you're wearing it to actually be around other people, there's a chance that it's been contaminated. So if it's a disposable medical mask, the manufacturer recommendations will say to throw it out unless you can disinfect it. If a reusable mask, like a cloth mask, the recommendations are to wash it before putting it back on. So just as an employer, these are a couple things to keep in mind. So if you're requiring your staff to wear a non-medical mask for work, they should have the ability to change them out when they need to without having to continually take off and put on a potentially contaminated mask. So the kind of situation you don't want to get into is giving everybody one mask and saying, you have to wear this mask all day. What if somebody like coughs in their face, or what if they drop it on the floor and somebody steps on it, like, and they aren't allowed to use a different mask? Or if it gets all wet, you don't want them having to like be breathing in a wet mask all day. People should be able to change them out when they need to, and they should have access to the appropriate amount of masks for that. If your staff are wearing medical masks as actual official PPE, potentially requiring them to put them back on again without disinfecting could be considered a violation of the OHS regs. I'm sure people have so many other things to worry about that you're probably not going to get like written up about something like that. But just if you want to be following best practices, that is something you should allow people to change out those masks. So surgical masks versus respirators. I'm going to talk about a little bit how they work and why you can't necessarily consider a surgical mask to be an appropriate fill in for a respirator. So the way that surgical masks work as PPE is they're designed to prevent liquid droplets from getting into the wearer's nose or mouth. So they're basically a splash guard. Like, they have a polypropylene layer that will prevent those droplets from soaking through the mask. If someone coughs on you, or like in a hospital setting, if someone vomits on you or something like that. Hopefully that doesn't happen too often, but like, it won't soak through immediately. But they don't filter air effectively. So I'm sure everybody here has put on a mask a few times, and you'll notice that the air, you can feel the air coming out the bottom. If you wear glasses like me, you'll notice your glasses getting fogged up. That's because the air is leaking out the sides and all around the spot where the mask does not seal to your face. So air is going to take the path of least resistance. And so even though I know people have posted stuff on the internet that says, like, you know, a cloth mask filters 60% of particles in this test versus an N95, which filters 95%, if it doesn't fit tightly, it's not getting the filtration efficiency that you think it actually is. Actual respiratory protection, like an N95, does fit tightly, and so it does actually filter the air. It is, however, expensive. It's currently hard to come by if you're not a hospital, and it also requires training and fit testing to use it. So there's a lot of regulations around it. So if you think you're going to need respiratory protection, you do need to talk to somebody who's qualified to help you out with that. You can't just buy a box of N95s and tell people to wear them, because if they don't fit people properly, for example, they're just going to be not much more effective than a surgical mask, which is going to be cheaper. So I've done a lot of work with respiratory protection, so I can help you out with that if you have any questions. Again, I'll have my contact info up at the end. And this is a bit of a hot button issue, so I hope I don't step on anyone's toes or values here when I talk about this, but this is right off a poster from Health Canada that there are certain people who can and should not be wearing medical masks. So as I mentioned, I've done lots of work with respiratory protection, and we put people in a respirator. They have to fill out this giant questionnaire saying, do you have any of the following medical conditions? If so, you need to consult a nurse or a doctor before you can even get fit tested for a respirator, because it might not be safe for you to put it on. I mean, a cloth mask doesn't fit as tight as a respirator, but at the same time, it is something that restricts your breathing. And so if people have certain illnesses or disabilities that make it difficult to breathe when breathing is restricted, they probably should not be wearing a mask. It may be dangerous for them to do so. So to be more inclusive of people of these potential health conditions or disabilities, it's much better, I think, to encourage and not mandate, even though we are starting to see people mandate. It's better to say, like, I think, you know, we strongly recommend that you wear a mask if you're able to do so, and things like that. But I mean, again, this may change. Maybe in a month we'll have a mandatory mask thing, and if you can't wear one, you have to present a card when you go into a business. I don't know how it's going to work, but anyway, this also may be an issue for your staff. This is what I want you to be aware of. So if you have any staff, if you're going to say we want you wearing masks at work, if you have any staff who have any issues that they think they maybe can't wear one properly, they should talk to their doctor, and if they have concerns about that, and then if their doctor says that they can't, then you as the employer should be accommodating them for that. And also, it's just very stressful, I think, for staff, especially in kind of some of these industries that have like a lot of summer students and stuff, to enforce customer behavior. So if you're asking your staff to enforce really any customer behavior, not just wearing a mask, but make sure that the behavior you're enforcing is actually going to reduce the risk and is something that you can reasonably expect people to do. I don't think anybody wants to get into a situation where their 19-year-old summer student is grilling people about their medical conditions as to why they aren't wearing a mask, for example. That's just probably not a good situation for anyone to get into. So that's about it for that. I'm going to talk a little bit about the word should, and then we'll go into the risk assessment. So the word should, I think, is causing a lot of confusion for people, and it's very common in a lot of guidelines, including Reopen Saskatchewan, or say like strongly encouraged, or think about this, or whatever. It's there to incorporate flexibility instead of saying shall all the time. Then that makes, you know, ties some potential businesses into doing things that just don't work for them at all. So it doesn't mean shall, but it also doesn't mean if you feel like doing it either. It means that if it is feasible to do, then do it. Or if you don't do it, then be prepared to explain what you're doing instead. Explain why you aren't doing it to a customer or an inspector or other staff members who might have a question about it. So an example of this would be, if you don't have your cashier at your business wearing a mask, but you have plexiglass and a few other controls in place, and so a customer might come in and say, I don't like the fact that your cashier isn't wearing a mask, you could say, okay, well, here's what we've put in place instead. We've got our front whole garage door at front of our business propped open, so there's lots of natural ventilation. It's almost like being outside. We have this plexiglass shield in place so that even if you or this person coughs, it's going to be, you know, blocked by the plexiglass. And so that's what we've done instead. We don't necessarily think it's, and we've also maybe extended our countertops so you can't even get within 6 feet of this person. You know, there's other controls in place, and that's totally fine to explain things that way if you have done something instead. So now we will go to this risk assessment worksheet. So if you want right now on your screen, you can go to the Saskatoon Community Commitment website. You can just Google it, and you should be able to find a web page that says, it's like the COVID-19 page, and right next to a YouTube video of this same webinar, there's some documents you can download, so feel free to take a look at that, or you can look at it after. But the way I would say to go about doing it is first kind of, oh, you know what? I think we have a poll. What is the poll? I remembered. So has your business reopened, or are you still developing your controls? I'm curious how many people, what stage everybody is in. And I will be, wonder if it's going to be 30-70, just like the other two questions. Oh, so it's a little bit of a difference. So 60% of you are open. There is 6 people and 4 people who voted. So hopefully only 10 people aren't just left in the webinar. But so yeah, but almost half and half here. So the way I would say to go about this, for those of you who have opened, maybe you don't want to go back all the way to before COVID, but for those of you who haven't opened yet, this would be an effective way to do it. So kind of forget the guidelines that you've seen. Then kind of use the worksheet and the guide documents. As I mentioned before, break each job at your business into a set of steps, kind of either as you perform them before COVID or as you're doing them now, if you want to try and tighten them up. And then perform a risk assessment for each step, and then suggest the possible controls. This would be ideally done by the staff who actually do these jobs. I think this is part of the workers' rights in Saskatchewan, to be honest. Workers have the right to be aware of the hazards in the workplace and also participate in implementing controls to control those hazards. So this is a good exercise to go through. They're probably also more familiar if you don't just have one person doing it. They may be able to suggest some more creative suggestions. So now, after you've done that, go back to the existing guidelines, reconcile your suggested controls with the requirements, and make your final decisions. So it could be a mix of short-term things that you're going to do maybe for the rest of the summer, and then things that you're going to consider doing in the long term, or maybe it's just what you're going to do going forward. So again, click a couple times. All right. So the first example on the worksheet is, I've just used a couple of restaurant examples, but I do want to say that this isn't necessarily what I think you have to do if you have this. This isn't necessarily the best way to go about it. It's just how this fictional restaurant that I made up in my head would maybe do it. So the job step would be have the server taking the customer's order. So they're verbally communicating with customers at their table and then retrieving their menus. So the transmission risk is the questions you ask. Is there person-to-person transmission risk? Is there contact transmission risk? In this case, there appears to be both. So using the hierarchy of controls, how could you possibly eliminate these risks? Maybe having people pre-order online and totally eliminate this job step is an effective way to do this. It could be. To substitute it, maybe you have like a chalkboard menu on the wall instead of regular menus or disposable menus, so you're not handing things back and forth. To engineer this out, maybe you could put a plexiglass shield at the cashier and then have customers order at the counter and not having people go back and forth to the tables. Administrative controls could be maybe making customers wear their masks when they order, putting markings on the floor for the server to stand, disinfecting the menus after they use them, and then PPE would be like a server wearing a surgical mask when they take the order. So then you want to look at the feasibility of all these ideas. So for elimination, so the pre-ordering online, it could be a low or high cost. It could be just depending if you're going to make software, if you're just going to have people like email or phone them in. But one thing for the social considerations could be that it might not allow for walk-in customers, and maybe some people have trouble doing the pre-orders or using the computer, things like that. Really depends on your customers. For substitution, so a chalkboard menu could be a pretty low cost, but maybe paper menus would be high cost, both financially and environmentally. For engineering, the plexiglass is kind of a mid-range one-time cost, but it is effective, and it seems like most places are doing it. And but maybe you have limited space for a counter lineup and you don't want people to be congregating there. So again, something to consider. Administrative controls would be, it's probably high cost in terms of time and money to be continually disinfecting menus. Customers might not like wearing masks, or they might not wear them properly, so they're just ineffective anyway, or maybe you have a high percentage of customers who might not be able to wear masks, things like that. And then for PPE, PPE have ongoing costs, and masks and surgical masks, like anytime a mask, can create communication issues as well. So maybe that's not something you want to deal with. So the final decisions here might be just saying, okay, we're not going to have walk-ins, we're going to do reservation only. Customers are going to pre-order over the phone or email when they reserve. And then maybe you post a weekly menu on your Facebook page for people to check out. And then your long-term decision might be try this to start. And then if you aren't getting enough customers here, maybe add that chalkboard menu and have people order at the counter, but encourage them to continue pre-ordering. A second example, and one thing too, is think about your customer tasks when you're doing your risk assessment. You want to be protecting your staff, but you also want customers to be able to feel safe when you're in your business. So this one would just be customers sitting at the table to socialize and eat, and the transmission risk here is between parties at different tables. And so this probably comes mainly from the fact that before COVID, you probably didn't have your table spaced 6 feet apart. And so we're just saying this is probably a more of a person-to-person risk due to the less than 2 meter distance between people. So potential controls and the levels here: to eliminate this, you could just continue doing takeout and delivery if possible. To substitute this, you could have outdoor dining that could maybe increase your capacity and also have better ventilation. Engineering controls would be spacing tables 6 feet apart and propping open outside doors and windows for better ventilation if possible. Administrative would be limiting your restaurant capacity, having customers wear masks, and having a time limit for the amount of time people spend in the restaurant. And PPE is really not applicable for customers because, as kind of I mentioned, PPE involves like training and kind of enforcement, and I don't think that's really appropriate for customers. So the feasibility things here would be for eliminating it, maybe you're not bringing in enough cash with just takeout and delivery, so it's just not feasible to continue to do this exclusively. For doing outdoor dining, people might like this, but maybe there's no available space to do it. For engineering, spacing the tables, you can space the tables, though it's going to reduce your capacity and profits, but opening doors and windows is free, so maybe that's a good one to do. For administrative, so I did put this together before the capacity for restaurants was removed. So there is no longer a capacity, but the spacing will kind of create that. Customers, again, might not communicate well with masks on, or just might not like the policy, or might not use them properly anyway. They also might not like a time limit. So what you might want to put in place here is you're going to do your table spacing, keep your entrance door propped open if weather permits to get good ventilation, and maybe encourage quicker turnarounds by having, like the other example, have people pre-order online so you can have things prepped when they get there and they aren't staying in the restaurant so long, spewing their respiratory droplets around. And then another long-term decision might be maybe you can figure out how to put a patio in a parking space or parking lot in front of your restaurant. So that is kind of it. So a recap of the presentation. So here's the hierarchy of controls again. The question you want to be always asking when you're doing your risk assessment is, how do we best minimize the risk? Not how do we completely get rid of it, because that's pretty unlikely, but how can you minimize it as low as you possibly can? And prioritize minimizing the risk of person-to-person transmission. I've seen lots of places that just go crazy on the cleaning, but they don't really do anything on trying to keep people apart and putting other kinds of controls in place. And I don't know, I think that a place that is kind of doing the bare minimum for cleaning, but going well above and beyond and keeping people separated is probably going to have lower transmission risk in general than someone that just like does only cleaning and nothing else. Higher level controls such as elimination, substitution, and engineering are more mistake proof and inclusive. So these are the ones you should really try to put in place if you can. Lower level controls, it's like administrative controls like policies and instructions and signs and PPE. and masks are only as effective as the people using them. So these should be things that maybe enhance your higher level controls and kind of, they're more visible, they make people feel safer, but they aren't actually safer than the higher level controls. So these are something, kind of figure out a good combination of them if you can. Masks can be a useful control in preventing spread, but be aware of their limitations. And I would say don't rely on them as your main protective measure, because there's things you can put in place that will be a lot more effective. And of course, involve staff in your risk assessment and control development. So to hear some more references, basically kind of any, a lot of stuff that I got and put into this presentation, if I referenced, came from anything here. Also, thanks again so much to Tourism Saskatoon for letting us represent this for Tourism Saskatoon, our Saskatchewan partners. And please check out the Saskatoon Community Commitment webpage for the kind of, there's like a cheat sheet that I made with hierarchy of controls, and also a risk assessment worksheet you can use. And so here's some good resources. I really like, I'm going to point out this risk mitigation tool for workplaces and businesses operating during the COVID pandemic from the Government of Canada. It's really awesome. It's very comprehensive and really kind of describes everything in a really good way. So check that out if you are interested in kind of reading a bit more on these lines. Be really careful if you're using guidelines outside of Saskatchewan, especially regarding things like PPE. Guidance from different jurisdictions is a little different, so you want to make sure you're using the most up-to-date stuff from the jurisdiction that you're operating in when you do follow guidelines. And on that note, again, a kind of disclaimer, COVID guidelines are really live documents. They change and evolve as knowledge of the disease advances. So I would say don't print something out and keep it for the next 6 months and keep referring to it. Always want to make sure you're using the most up-to-date stuff. So I'm going to flash my contact info here, and then I'll go back to the resource slide in case there's stuff you want to look at again. But here's my email address, or you can just email Tourism Saskatchewan or Tourism Saskatoon and get them to put you in contact with me. I am being paid to help you out if you need it for the next little while, so it's totally free for you. If you have any questions, want me to look at your controls and things like that, I can definitely do that for you sometime over the next couple weeks if you would like. So I think there was like one question that I saw come up. I don't know how to.
Oh, I think it was about, is this going to be available after? And yes, it will be.
Okay. Yep.
Yeah, so we're recording it and it will be available on our YouTube channel, and you'll also receive a copy because you registered for this. So please share it with as many people that you think need it. I'd like to take a moment to thank Robyn. Thank you very much for sharing all of your information with us. You got us really thinking about how to apply risk assessment processes and procedures. And I think it's really important, like you said, to think about what's feasible and reasonable for your own organization, right? Because some things will work, some people won't, but also to partner and collaborate and talk to other people who are in your same situation and see what they're doing, which I'm sure a lot of you are doing already. I'd also encourage everybody to get in touch with Robyn if you can, or if you would like. She has so much knowledge around this area. She's really an expert, and she can definitely help you out if you have any questions. Does anybody have any questions right now that they have for Robyn that we can just put into the Q&A or the chat?
It's okay if you don't, or if you have something that you're a little bit shy to ask, you just send me an email too, that's fine.
Sure. Okay, I'll just give it a second. Okay, well, I think that's all we have for today. Yeah, so thanks, Robyn. Do you have anything else you'd like to add, or?
No, I just thank you so much for tuning in, and hopefully the lack of questions means that it was so thorough and that you don't have any questions and everything was answered during the presentation, and not that it went all over everybody's head. So thanks again, and please contact me if you do have any follow-up questions, or if you think about something that you didn't quite make sense and then you figure out how to word it tomorrow. Like, that's totally great.
Great. All right. Thanks everyone for joining us. Take care.